Hello, Dr. Amar's here, and in this lesson we will talk about the components of the back, and at the end we will have some review questions. If you have any question, you can email me here at ammar@goodrationhealth.com or comment your question down below. In the first lesson, we have mentioned that the main bony element of the back are the vertebrae, and they are 33 in number, but their specific characteristics and number differs depending on the region with which they are associated. For example, we have 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 3 to 4 coccygeal. The 5 sacral are fused together as a single bony element called the sacrum, and the coccygeal are rudimentary in structure, and they are often fused together as a single element, the coccyx. Let's talk about the typical vertebra. The typical vertebra consists of a vertebral body anteriorly and a vertebral arch posteriorly. The vertebral body is the major weight-bearing component of a vertebra, so almost all of the weight coming to the vertebrae is beared by vertebral bodies. As you can see, it increases in size as it descends downwards from cervical 1 to lumbar 5, the cervical 1 being the smallest and the lumbar 5 being the largest. We are not considering here the sacrum or the coccyx because these bony elements are often fused together to one sacrum and one coccyx. We also have a fibrocartilaginous structure, intervertebral disc, that separates vertebral bodies from each other. Let's see another picture. As you can see, the vertebral arch is firmly anchored to the posterior surface of the vertebral body by 2 pedicles, one on each side. These pedicles form the lateral pillars of the vertebral arch. See here, the pedicles move backwards, slightly upwards, and then connects the body with the laminae. The laminae move upwards, backwards, and medially. Here, upwards, backwards, and medially. And they fuse and meet in the midline and then give the spinous process. That's why the laminae is considered to form the roof of the vertebral arch because they move upwards, backwards, and medially. They are the roof of the vertebral arch, right and left laminae, and they fuse in the midline. The vertebral arches of the vertebrae are aligned to form the lateral and posterior walls of the vertebral canal. Let's see, this is the vertebral canal. The anterior bony wall of the vertebral canal is the vertebral body. The lateral walls are formed by the pedicles, and posterolateral walls is formed by the laminae. The vertebral canal extends from cervical 1 to sacral 5. This bony canal contains the spinal cords and associated meninges, together with blood vessels, connective tissue, fat, and proximal parts of spinal nerves. The vertebral arch of a typical vertebra has a number of characteristic projections, which are spinous process, transverse process, and the facets and for articulations. Okay, these projections serve as attachments for muscles and ligaments, sites of articulation with adjacent vertebrae, and then levers for action of muscles. The spinous process projects posteriorly and generally inferiorly from the roof of the vertebral arch. Posteriorly and inferiorly from the roof of the vertebral arch. And then on each side of the vertebral arch, the transverse process extends laterally from the region where the lamina meets the pedicle, and then from the same region a superior articular facet and an inferior articular process articulate with similar processes with adjacent vertebra. Muscles in the back can be classified as extrinsic or intrinsic. This classification is based on the embryological origin and the type of innervation. They are not based on the depth of the muscle, rather the embryological origin and the type of innervation. The extrinsic muscles are innervated by the anterior rami of spinal nerve, and the intrinsic muscles are innervated by posterior rami of spinal nerves. The extrinsic muscles are also divided into superficial layers and intermediate layers. The superficial layers are concerned with movement of the upper limbs. However, the intermediate layers are involved in the movement of the thoracic wall. So superficial layer, upper limbs, intermediate layer, thoracic wall. Here's the intermediate layer. But all of the intrinsic muscles or deep muscles of the back are deeply positioned and innervated by the posterior rami of spinal nerves. They support and move the vertebral column and participate in moving the head. A part of superficial extrinsic muscles may be innervated by the cranial nerve 11, trapezius muscle. So anterior rami of spinal nerves or cranial nerve 11. Then we have the vertebral canal. It is the bony canal formed by adjacent vertebra and soft tissue element. The anterior wall is formed by the vertebral bodies, intervertebral disc, and associated ligaments. The lateral walls are formed by the vertebral arches and ligaments, and the vertebral canal contains the spinal cord and its meninges, which are the pia mater, the innermost membrane. It's intimately associated with the surface of spinal cord. The second membrane is the arachnoid mater. It is separated from the pia mater by the subarachnoid space. The subarachnoid space contains the CSF or cerebrospinal fluid. The thickest and outermost layer is the dura mater. It lies directly against, but it's not attached to the arachnoid mater. It is also separated from the surrounding bone by extradural space or epidural space, containing loose connective tissue, fat, and venous plexus. Lastly, we have spinal nerves. There are 31 pairs of spinal nerves. They are segmental in distribution, as you can see here in this picture. They emerge from the vertebral canal between the pedicles of adjacent vertebrae. There are 8 pairs of cervical nerves, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Each nerve is attached to the spinal cord by a posterior root and an anterior root. After exiting the vertebral canal, each spinal nerve branches into posterior ramus. Collectively, the small posterior rami innervate the back, and anterior ramus. Much larger anterior rami innervate most other regions of the body except the head, which is innervated predominantly but not exclusively by cranial nerves. The anterior rami form the major somatic plexuses, cervical, brachial, lumbar, and sacral of the body, and major components of the peripheral nervous system. Sympathetic trunk and prevertebral plexus of the body are also associated mainly with the anterior rami of spinal nerves. So the components of the back are vertebrae, bone, muscles, extrinsic and intrinsic, the vertebral canal, and spinal nerves. Lastly, we have some questions. Please take your time and write your answers in the comment section. Question number 1. The smallest vertebral body is seen in which vertebra? The largest vertebral body is seen in which vertebra? Which part of the vertebra is the major weight-bearing component? Vertebral arch, lamina, pedicle, or vertebral body? The roof of vertebral arch is formed by which structure? The vertebral canal extends from C1 to lumbar 4, C1 to sacral 5, cervical 2 to lumbar 5, cervical 1 to coccyx, cervical 1 to lumbar 5. The spinous process is a bony projection that originates from which point? The transverse process is a bony projection that originates from, choose an answer. The lateral pillars of the vertebral arch are the laminae or pedicles, or superior facets, inferior facets, or transverse process. The function of vertebral projections is which answer? How many vertebrae in the human vertebral column? Muscles of the back are classified as extrinsic or intrinsic based on what? Extrinsic muscles are innervated by intrinsic muscles are innervated by superficial extrinsic muscles of the back are involved in intermediate extrinsic muscles of the back are involved in intrinsic muscles of the back are responsible for the innermost meningeal layer is called the outermost meningeal layer is called CSF is contained in which space? All of the following present in extradural space except the head is predominantly innervated by how many pairs of spinal nerves in the human body? How many coccygeal pairs of spinal nerves exist in the human body? That's for today's video. Thanks for watching. See you in the next video.